hygiene for 20 seconds. Hello, my name is Nguyen. I'm going to be your nurse today. Can I get your name and date of birth? Julie Smith, July 6, 1960. All right, double check the ID bin here. Looks like everything checks out. Julie, do you have any allergies? No, you don't. All right, so our doctor has ordered you a urinary catheter insertion and a urine sample today because it seems like you have some trouble urinating. Is that right? It's true? Okay. So have you had this procedure done before? You have? Okay. I'm just going to review it with you really quick, okay? Basically what I'm going to do is I'm going to clean your genital area, and then I'm going to insert a urinary catheter into your urethra up to your bladder and help relieve you of all the urine that's in your bladder, okay? That's great. Okay, fantastic. So you have any pain right now? No pain? You have any questions for me? No? Okay. So if you have any pain or questions during the procedure, please let me know, okay? Fantastic. All right, I'm going to put on some clean gloves now. Now that my clean gloves are on, I'm going to be wiping this table down for 30 seconds, okay? Okay. I notice that you're already in the supine position, Julie, which is great because that's the position I need you to be in for this procedure. I've also already closed your curtains for privacy. Is that okay with you? Of course. Privacy is very important for a procedure like this. Okay. I'm just going to continue wiping for 30 more seconds. All right, we should be coming up on the 30-second mark now. All right, should be pretty clean. All right, should be 30 seconds now. All right, as I wait for this table to dry for 2 minutes, I'm gonna perform more hand hygiene. All right, looks like the table's dry, so let's start bringing our supplies over. First thing we do, grab the smaller supplies. CHG wipe, stat lock, and syringe. Next thing I'm gonna do, I'm gonna grab my kit and my wipes. Last thing I'm gonna do is grab my chucks. Technically, this chuck is actually for you. And hygiene for 20 seconds. 20 seconds over. All right. Put on some new clean gloves. Are you ready to be clean, Mrs. Smith? You are? Fantastic. All right, I know this procedure is going to be a little breezy, so I have this warm blanket for you. Would you like it? You would? All right, here you go. Also, I'm going to externally rotate your thigh outward in a frog-like position, okay? Okay. All right. Frog-like position. There you go. Frog-like position. There you go. Are you okay with that? Great. Last thing I'm going to do is actually I'm going to give you this chucks, okay? Are you all right? Ready? There you go. Chucks has been given. The last thing I'm going to do, I'm just going to open up your gown, okay? Pull up your gown. All right, how's that? Feeling good? Great. Ready to be clean, Mrs. Smith? You are? Fantastic. All right, first things first, I'm gonna hold onto your labia here and give you one wipe, all right? There you go, one outer edge wipe. Another outer edge wipe. And finally, right down in the middle, okay? You okay with that, Mrs. Smith? I'm just gonna, it's okay if I leave you exposed for now? It is? Great, okay. I'm going to dispose of this as well. Perform some hand hygiene. 20 seconds. Put on another pair of gloves. Okay, now that I have new clean gloves on, I can now open up my kit. Also just going to rotate it a little bit. Okay. I'm going to take out my sterile gloves here because I will be needing them. I do see a drape here. And yes, it's for you. All right, shiny side down. No touch technique. Perfect. Also just going to throw away this drape. All right, time to put my supplies in. Okay, just gonna drop in my stat lock here. Wow, it definitely dropped. Okay, last thing I'm gonna do, put my syringe in here. Fantastic. Last thing I'm gonna do is get my alcohol swab, or my CHG, and drop it in here. Okay. Perfect. Now I'm gonna take off my gloves, perform hand hygiene, and put on my sterile gloves. Perfect. All right, time to put on my sterile gloves. Okay. All right, now I'm just gonna toss this out the edge. All right, now I'm gonna move around my kit, okay? Take this out here, take the swab out, take the syringe out, okay. Now I can start messing with my kit now. Just gonna put this on the corner over here. Put this right down the middle. And take this plunger out. Okay. All right, first thing I'm gonna do is actually I'm gonna prepare my sterile water into the balloon port. There we go, it's connected. Next thing I'm gonna do, get my tubing, the sheath, the tube, I'm gonna get the sheath out. Last thing I'm gonna do, I'm gonna put it right there into the lube. Fantastic. Last thing I'm gonna do, get my specimen cup out. I'm gonna unscrew it a little bit and leave it right there. All right, looks like all my supplies are ready. So let's start bringing it over to the patient. All right, Smith, are you ready to be cleaned again? You are? Fantastic. Okay, let's do this. All right, first things first, one outer swipe. Fantastic. Another outer swipe. Fantastic. And now an inner swipe to really clean it all together. Fantastic. All right, Mrs. Smith, are you ready to have the urinary catheter inserted? You are? Fantastic. All right, on the count of 3, I want you to breathe out for me, okay? Ready? Breathe in. All right, 1, 2, 3. Breathe out, breathe out, breathe out, breathe out, breathe out, breathe out. Oh, I feel some resistance. Or I see urine flash, I mean. All right, I'm just gonna advance 1 more inch, okay? 1 more inch of advancement. Fantastic, Mrs. Smith. All right, I'm gonna activate the balloon port. There we go. Let's go, let's get all of it in there. And I'm just gonna take this out. I'm gonna tug for some resistance. Oh, I feel some resistance. That's great, that means it's in there. And now I'm just gonna cover your gown, okay? Okay, fantastic. All right, next thing I'm gonna do is I'm going to get my alcohol swab with a taco fold. I'm gonna clean the port for 5 seconds. I mean CHG. I'm gonna clean for 5 seconds. All right, it's clean. Now I'm gonna extract 10 cc's of urine here. Let's extract 10 cc's. All right, we got 10 cc's of urine. That's fantastic. I'm gonna put it right back here. All right, let's take off my sterile gloves now. Hand hygiene for 20 seconds. Put on a new pair of clean gloves. Okay, are you ready to have me stabilize this to your thigh? You are. Great. Just gonna grab the skin prep pad here. Gonna locate your thigh and just give you a good skin prep. Okay, skin has been prepped. Next I'm gonna do, grab my stat lock here. I'm gonna open it. Make sure it's facing the right direction. I'm just gonna put this right there into the stat lock, okay? Now I'm gonna grab the urine bag. I'm gonna make sure the stat lock is secured onto your leg or your thigh here. And I'm gonna make sure the bag is below your bladder level. All right, looks like everything's in the right place. Fantastic. All right, I'm just gonna start disposing of this while I have my gloves on still. Gonna move your chucks as well. And I'm going to externally re-rotate your thighs, or just internally rotate your thighs back into position, okay? Okay. All right, would you like me to cover up with your blanket as well? You would? All right. Now you're nice and covered up, all right? I'm gonna take my gloves off one more time. Perform hand hygiene. My gloves on again. Okay. Now I'm going to open this cup, get my 10 cc's of urine, carefully inject all of it into the cup. Perfect. Last thing I'm going to do, get the cap, re-screw it onto the cup. Write the patient's name, the date and time, and the MRI number, and I will be sending this to the lab. All right, Mrs. Smith, how are you? You feeling good? Did you tolerate the procedure? You did? Great. So I'm going to put your call bell right here. I'm going to put your rails up, put you in the lowest position. Fantastic. So do you have any questions or any pain? No? Fantastic. All right, so after this, I'm going to document the date and time that I did the procedure, the patient's tolerance to the procedure, the size of the catheter used, which was 16. I'm also going to document the urine, right? It was clear and yellow, and there's around 150 mmLs. And there you go. Now take off my gloves, perform hand hygiene, ask one more time. So do you need anything, Mrs. Smith? No? Great. Okay, so I'm going to out then. Remember, your call bell's right there, and you can use it anytime. Goodbye, Mrs. Smith. Hand hygiene for 20 seconds. Hello, my name is Nguyen Han Nguyen. I'm going to be your nurse today. Can I get your name and date of birth? Julie Smith, July 5th, 1960. Okay, double check the ID band. Checks out. All right, Julie, do you have any allergies I should know of to maybe chlorhexidine or latex? No? Great. So, your doctor has ordered you a urinary catheter removal today because you no longer need a urinary catheter. Sorry. Have you had this procedure done before? You have? Okay, I'm going to just review it with you really quick. Basically, what I'm going to do, I'm going to remove your urinary catheter from the stat block. I'm going to place it onto the chucks, and then I'm going to extract all the water from the balloon port with my 10 ml syringe, and then I'm just going to remove the catheter, the tube, from your bladder. Okay, does that make sense? It does? Great. So, do you have any pain right now? No? Any questions for me? No? If you have any pain or questions during the procedure, please let me know. Okay, thank you. Hand hygiene again, I guess, for another 20 seconds. Okay. Put on my clean gloves. Another pair of clean gloves. All right, are you ready for the procedure, Miss Smith? Okay, I noticed you're already in the supine position, which is great because that's the position we need you to be in for this procedure. Let me start bringing my material over then. Here's my chucks, my alcohol swab, and my 10 ml syringe. All right, I'm gonna start removing your blanket, okay? Thank you, Mrs. Smith. Okay, I'm also going to externally rotate your thighs, okay, into a frog-like position, okay? Okay, thank you. Okay, it's externally rotated. Now I'm gonna lift up your gown, okay? Actually, before I lift your gown up, I'm gonna give you this chucks, okay? Oh, that's what it was. Okay, here is your chucks. All right, Mrs. Smith, I'm just gonna lift up your gown now, okay? Okay. All right, are you ready for the procedure, Mrs. Smith? You are? Fantastic. Like I said, first thing I'm gonna do, remove this from the stat block and place it onto your chucks here. Next thing I'm gonna do is get my 10 ml syringe and remove all the water from the balloon port. Okay. Good amount. Close that. Next thing I'm going to do is I'm going to pull out the urinary catheter, okay? So on the count of 3, I want you to breathe out for me, all right? So 1, okay, so breathe in for now. 1, 2, 3. Perfect. I'm just going to wrap this and the chucks. Okay, so with this new Foley bag, I'm going to bring this to the bathroom. All right, I'm going to empty it into a graduated cylinder, and I'm going to measure the amount, which is 300 mLs, and then I'm going to remember the description, which is around clear and yellow urine. Now that that's over, I'm going to dispose of this in the appropriate receptacle. All right, next thing I'm going to do, I'm going to remove your stat block from your thigh here. Okay, that's been removed. Now I'm going to put you back into your comfortable position, okay? All right. Internally rotate thigh. Internally rotate. Now I'm going to put your gown back, okay? Okay. And I'm going to put your blanket back, okay? Okay. Nice and warm. Feeling good? Great. Take off my gloves. And hygiene. Okay, Mrs. Smith, how are you feeling? Did you tolerate the procedure well? You did? Great. Okay, so I have to let you know that I will be measuring your next 1 to 2 voids to ensure that you have adequate bladder emptying, all right? The first void might sting and burn, but it should lessen over time. Also, if you begin to have painful urinations, or you're not able to urinate, or you start bleeding during your urination, please let me or another nurse know, okay? Because that's very crucial information for us. Okay, so I'm gonna put your guardrails up, gonna put your bed call light next to you, and if you have any questions or pains or concerns, please let me know, okay? Okay, so after this, I'm gonna document the date and time I did this procedure, the patient's tolerance, and I'm gonna document the measurement and the description of the urine, which was 300 mLs, clear and yellow, and I'm also going to document the measurement and the description for the next 1 to 2 voids. All right, Mrs. Smith, have a good day. And hygiene for 20 more seconds, and I'm out.